Today also let's start with the same topic, skeletal system. Skeletal system provides structure, shape, as well as support to the body, mostly facilitates our body to move. The skeletal system consists of all the bones, cartilage, tendons and ligaments. And we know that what are cartilages? They are the soft, elastic or flexible bones. They are found on the tip of the nose and ears and in some of the other parts of the body like in between the vertebral columns. Okay. How tendon helps the muscles to attach the bone. Similar to that, the ligaments help one bone to attach the other bone. The adult human skeleton consists of 206 bones, but in newborns, actually more than 300 bones are present. But after the growth of the baby, the bones will fuse together. Few of the bones will fuse together to form single bones. Hence, the number of bones are decreased as they grow up. Human skeleton is divided into or classified into two different types. They are axial skeleton and appendicular skeleton. Axial skeletons are the bones that are present in the middle part of the body. They are called as axial skeletons, so which includes the skull, vertebral column and thorax. At the same time, the appendicular skeletal system consists of pectoral girdle, upper limb, pelvic girdle and lower limb. Let's see what are these things. We know that the parts of axial skeleton like skull, that is our the bone of our head. Skull means that the bone of our head, vertebral column, that is the backbone, the thorax, that is a chest region which consists of the thoracic bones like ribs and the sternum. Then the appendicular skeleton consists of the pectoral girdle, that's a part of the or the bones of the shoulder. Upper limb, they are both the hands. Then pelvic girdle, that is the hip. Then and the lower limb, they are the legs. How axial skeleton consists of the bones of the middle part of the body, the same appendicular skeleton consists of the side part of the body, the bones of the side of the body. Let's see in this picture. Here the bluish marked one, they are the parts of axial skeleton which include skull, rib cage or thorax and the backbone or the vertebral column. Here you can see the parts of the skull and they are the bones in the hip region and the which one, the backbone, they are the vertebral column, parts of the vertebral column which consist of vertebral discus and the vertebral bones. Now let me show you the cartilage, the soft, elastic or flexible tissue. They are the connective tissue. They are the cartilage. They are present in between the two bones where the two bones are meeting or joining in the joints. Now we go to the parts of the bone. The outer covering of the bone, that is called as periosteum, outer layer of the bone, that is called as the periosteum, and inside of the outer covering or the periosteum, there you can see the hard compact bone. Then internally the compact bone lined with another layer of bone, that is called as endosteum or endosteum. Each bone has a point of origin or a starting point, otherwise called as proximal part of the bone, and the end portion, that is called as the distal part of the bone, and both the starting point and the end point, they are called as the epiphysis, and the middle portion, they are called as the shaft, that is otherwise called as diaphysis. Each bone that are articulated or connected with or joined with other bones will have a cartilage part over the articulation surface, and they are called as articular cartilage, and inside of that particular region it is bone is appearing like very soft and are called as spongy bones. Then internally there is a cavity inside the bone, that is called as marrow cavity, which are enriched with a large number of blood vessels, and they are called as bone marrow. Let's see once again the parts of the bone like articular cartilage, spongy bone, periosteum, endosteum, compact bone, marrow cavity, then spongy bone and bone marrow, in which the blood cells are produced. Now let's see the skull, that consists of cranial bones, facial bones, ear ossicles, hyoid bones. The cranial bones, they are 8 in numbers. Facial bones, they are 14 in numbers. Ear ossicles or ear bones, the bones that are present internally of the ears, they are in both the sides, including both the sides, they are 6 in numbers. And hyoid bone, that is single in number, located in the throat region just below the lower jaw. Bones on the skull are flat and are joined by sutures. Its back portion is called as cranium or calvaria or brain box, in which the brain is located. This is the cranium. And we come to the face. Next, go to the hyoid bone. Let's see the cranial bones. They are frontal, parietal, occipital, temporal, ethmoid and sphenoid. Facial bones, they are zygomatic bones, nasal bone, maxilla, mandible, palatine bone, vomer bone, inferior nasal concha or lacrimal bones. Let's look at the skull. You can see the frontal bone on the front of the skull, the parietal bone on the roof of the skull, then the occipital bone on the back of the skull, back lower portion of the skull, and the temporal bone on the sides of the skull. The ethmoid bone is located inside the nasal cavity and the sphenoid bone is in the inferior part of the skull, appearing in the shape of a butterfly, and the red marked portion you can see as the wings of the butterfly. This is the sphenoid bone. Now let's see the facial bones, 14 bones of the face. Orbital cavity contains the lacrimal bone, the cheekbone, that is the zygomatic bone, and the bone that is present in the nose, that is the nasal bone. Then the maxilla, that is the upper jaw. Inferior nasal concha is present inside the nasal cavity. And the vomer is present in the lower nasal septum attached to the ethmoid bone inside the nasal cavity. Occipital bone is present in the back portion of the skull. This is the nasal cavity. Inside, the ethmoid and the vomer bone together makes the nasal septum that separates the right and left chamber of the nasal cavity. Nasal cavity consists of 3 nasal conchas like inferior, middle and superior nasal conchas. They are present internally of the nasal cavity. The orbital cavity consists of the lacrimal bone and the lower jaw, otherwise called as the mandible, that is articulated or joined with the temporal bone and forms the temporomandibular joint. Now let's see the hyoid bone located under the lower jaw and are not articulated with any of the bones but tightly held by the surrounding muscles. Now let's see the bones of the backbone. First 7 are cervical vertebrae, 12 are thoracic vertebrae, next 5 are lumbar vertebrae, the next 5 are sacrum but they are fused together to form one. The next 4 vertebral bones are coccyx and they are fused to form one. Single bones. Let's see the curvatures on the vertebral column. There are 2 primary curvatures and 2 secondary curvatures. In the early stage of the life, even during the embryonic development, the baby's body is curved. That makes the primary curvatures, and when the baby learns to sit and keeps the head and body straight, it makes the vertebrae to curve. Thus, it forms the secondary curvatures. The first cervical vertebrae is called as the atlas and the second one is the axis. The whole skull is resting on the atlas, the first cervical vertebrae. Atlas has a hole in the center. Axis has a finger-like bony process or projection over it, and this finger-like projection is fixed in the hole of the atlas. Thus, atlas can easily rotate or slide on the axis. Thus, we can rotate our head side to side. The first 7 vertebrae are the cervical vertebrae. They are located in the lower part of the head and in the neck region. They are named as C1, C2, C3, C4, C5, C6 and C7. Now see the thoracic vertebrae, 12 in numbers, named as T1, T2, T3, etc. They are in the chest region and connecting with the 12 pairs of ribs and forms the back of the thoracic cage. We can easily identify them by looking at the button-like articulating point of the ribs. Now see the lumbar vertebrae. They are 5 in numbers, just below the 12 number of thoracic vertebrae. are named as C1, C2, C3, C4 and C5. See the diagram, they are actually 5 in numbers but fused together to form one. Similar to that, the tailbone or the coccyx that are actually 4 in numbers fused together to form one single bond.